Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Preventing MRSA infections, Healthcare, Introduction. MRSA is a bacterial infection that is difficult to treat with antibiotics. While at the hospital, patients and healthcare providers should be extra careful to avoid getting infected. An MRSA infection could be life-threatening. It is estimated that more than 1 million patients contract MRSA at hospitals. If you or your loved one is hospitalized, you need to learn how to prevent an MRSA infection and recognize its signs. This program explains what an MRSA infection is for patients at healthcare facilities. It discusses its causes, symptoms, diagnosis, and treatment. It also gives tips about how to prevent an MRSA infection from occurring in the first place. Background info, bacteria and antibiotics. This section reviews important words and concepts that will help you understand MRSA infections. Germs are all around us. There are millions of them in the air and on our skin. Viruses and bacteria are two kinds of germs. The staphylococcus, or staph, is a type of bacteria. The MRSA germs are staph bacteria. Many parts of the body specialize in fighting germs. All of the germ-fighting parts of the body together make up the immune system. Sometimes, germs can get past the immune system's defenses and cause infection and inflammation. If the immune system does not win the fight against an infection, the infection could spread to the blood and other parts of the body. If not treated, these infections could be life-threatening. Scientists have developed antibiotics to fight bacteria. Antibiotics are not good at fighting viruses. There are powerful antibiotics to treat bacteria, but they can sometimes cause side effects. Viruses and bacteria keep changing their structure through a process called mutation. Scientists call these new mutated germs strains. New strains of germs can become more resistant to antibiotics. If the new strains are more resistant to antibiotics, they become difficult to fight and more dangerous. MRSA is a strain of staph that is resistant to the antibiotic Methicillin. MRSA. A type of staph bacteria is called Staphylococcus aureus. Some strains of these bacteria become resistant to the antibiotic Methicillin. That is why they are known as methicillin-resistant Staphylococcus aureus, or MRSA. There are two ways you can have MRSA. You can have an active infection. An active infection means you have symptoms. The types of symptoms depend on where the bacteria are located. Usually, an active infection is a skin infection, such as a boil, a sore, or an infected cut. You can be a carrier. If you are a carrier, you do not have symptoms that you can see, but you still have MRSA living on your skin and in your nose. If you are a carrier, your doctor may say that you are colonized. The words carrier and colonized mean the same. It is important to remember that if you don't wash your hands properly, the things that you use or touch with your hands can give the bacteria to other people. MRSA can still be found in the secretions that come out of your nose or mouth when you cough or sneeze. If the infection is not discovered in time, it could spread through the body, causing skin infections or pneumonia. It may be life-threatening if not treated successfully. People who carry MRSA bacteria but are not sick are colonized and described as carriers. About 1/3 of all people have MRSA on their skin and in their nose. MRSA bacteria are generally harmless unless they enter the body through a cut or a wound. Even then, MRSA causes almost no trouble in healthy people because the immune system fights it. People who have weak immune systems cannot fight infections as well as healthy people. That is why MRSA infections are more serious in young children, older adults, and sick patients. MRSA infections can also cause a more serious illness in patients with very weak immune systems, such as in HIV patients and patients undergoing chemotherapy.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Transmission. A person can get infected with MRSA either from a person who is carrying it or from someone who is infected by it. The bacteria are spread by touching a person with MRSA directly or by touching something he or she touched. In serious cases of MRSA infection, the patient may develop pneumonia. Pneumonia is an infection of the lung. Patients with pneumonia cough a lot. Healthy people who get MRSA on their skin are not infected because healthy skin does not allow MRSA infections to develop. However, if there are cuts or scrapes on the skin, the bacteria invade the tissue and may start an infection. Scientists distinguish two types of MRSA, depending on where the person got the infection. 1. Healthcare-associated MRSA, which means the person got the infection at hospitals or another healthcare facility. 2. Community-associated MRSA, which means the person got the infection in the community. When a patient contracts MRSA at a hospital, it is usually more serious because the patient is already sick. In addition, hospitalized patients may have an incision or wound because of surgery or the insertion of a medical device in the skin. This makes it easier for MRSA to get inside the body and start a deep infection. Community-acquired MRSA is common in places where people get a lot of skin scrapes or wounds. Outbreaks of community-associated MRSA tend to show up among teen players of contact sports, such as football and wrestling. They also often occur in military training camps, prisons, and in areas where children play in unsanitary conditions. Symptoms. Early MRSA infections are skin infections that produce small red bumps on the skin. These skin infections could become filled with pus and cause blisters that become painful. When an MRSA infection spreads to deeper parts of the body, more severe symptoms occur. Signs include fever, chills, headaches, rash, joint pains, and shortness of breath. These symptoms require immediate medical attention. Tell your doctor if you have these signs and you notice any skin abnormality. Diagnosis. If you have MRSA or have had it in the past, tell your healthcare provider. That way, they can give you the extra care you need and the right antibiotics when needed. At the hospital, you may be tested for MRSA if you have signs of infection or if you are transferred from another healthcare institution that has MRSA. You may be tested if your physician feels you may have been exposed to MRSA. To diagnose MRSA, your healthcare provider takes a sample from your skin or pus on the skin and sends it to the lab. Blood, urine, and other tissue samples could also be used. If you may have been colonized with MRSA, a swab from each side of your nose may be sent to the lab. The lab technicians may use a culture to test your sample. This may take a few days. Treatment. In hospitals and healthcare facilities, doctors prefer not to use antibiotics to treat mild MRSA that is not causing severe infections. This is so MRSA doesn't become even more resistant to antibiotics. For mild to moderate skin infections, doctors may first drain the skin abscess caused by MRSA. For severe infections, doctors may use an antibiotic such as vancomycin. Prevention. At the hospital, to protect yourself and your visitors from MRSA, wash your hands often and ask hospital staff if they have washed their hands before touching you. Hospital staff or housekeeping will clean your room and cluttered areas. Keeping these areas clean can help reduce the risk of spreading or getting MRSA. You can ask for soiled or cluttered areas to be cleaned. To avoid spreading infections to themselves and others, healthcare staff should disinfect hospital surfaces, wash their hands, use hand sanitizing gel or foam when hand washing is not possible, disinfect the skin before inserting catheters or tubes, wear a mask, gloves, and eye protection whenever there is a splash danger, i.e., suctioning. Outside the hospital, you can reduce your risk of MRSA by following these guidelines. Wash your hands well and often. Use hand sanitizer when you can't wash your hands. Keeping a bottle of hand sanitizer gel or foam with you at all times can make it easier for you to sanitize your hands at any time. Keep wounds and scrapes clean and covered. Avoid sharing towels, sheets, razors, clothing, and other personal items. When exercising at the gym or participating in athletic games, shower immediately after each game or session. Wash towels and athletic clothes after each wearing, and don't share personal items. You can help prevent new strains of antibiotic-resistant germs by taking antibiotics only when necessary and prescribed by the doctor. Follow your doctor's or pharmacist's instructions when taking antibiotics. If the doctor wants you to take all of the prescribed pills, don't quit taking them just because you feel better.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Conclusion. MRSA infection is a bacterial infection that is difficult to treat with antibiotics. While at the hospital, you should be extra careful to avoid getting infected. MRSA infection could be life-threatening. At the hospital, to protect yourself and your visitors from MRSA, wash your hands often and ask hospital staff if they have washed their hands before touching you. To avoid spreading infection to themselves and others, healthcare staff should disinfect hospital surfaces, wash their hands, use hand sanitizing gel or foam when hand washing is not possible, disinfect the skin before inserting catheters or tubes, wear a mask, gloves, and eye protection whenever there is a splash danger, i.e. suctioning. If you have a history of MRSA, are colonized or infected with it, you may be placed on special contact precautions. A contact isolation sign will be placed on the door. In addition to routine precautions, persons entering the room will wear a gown and gloves. The gown and gloves will be removed and hand sanitized before the person leaves the room. Tell your doctor or healthcare provider if you notice anything that doesn't look normal on your skin, such as red bumps. If you have MRSA or have had it in the past, tell your healthcare provider so he or she can give you the extra care you need.
Thank you for using Explain.